What really made Strive the right partner for NANI is their culture, their attitude towards the patient, their understanding that this is focused on the patient. NANI was founded by Art Morris and his partners in 1968, back when dialysis was an experimental treatment. They founded a dialysis unit in the basement of a church at a time when dialysis wasn't even paid for, but they did it because it was the right thing to do for their patients. And that culture has carried us through over 50 years now.
Strive has been an excellent partner to work with on this large value-based care project because there was a lot of things that we needed help compiling. There's a lot of data and analytics. We needed additional care teams, and we felt that bringing in another group would give another perspective and allow us to bring in some of these different features that we don't currently utilize in our everyday practice.
I was very skeptical of value-based care when it was first presented to me. I'm old enough to remember HMOs from the 90s, where physicians got paid for denying care to people. But when I realized that value-based care was patient-centric and driven by the nephrologists, and we're actually going to be rewarded for providing additional care and keeping the patients out of the hospital, and what a benefit this was for the patients, I became a convert. We evaluated a number of partners over a 5-month period. We called them back to meet with all of our committees, and we vetted all of our partners very thoroughly. And Strive came out on top in a unanimous vote. And what Strive brings to us is expertise that we did not have, and they have a history of success in value-based care.
As a nephrologist, I was looking for the company that would provide the most resources for our patients and our practice. Strive provides a lot of different things. They provide special data analytics that allow us to look at our patient populations in ways that we weren't able to do before. We can utilize these analytics to bring in additional care team members that we didn't previously have to allow our patients to have more assets and more people to help them.
The reason NANI chose to partner with Strive is fivefold. This is their business. This is not an ancillary business for them. This is their main focus. Their culture aligned with our culture. Their patient-centric approach aligned with us. Their capabilities in the data and analytics. This really is an inflection point for nephrology, and I think for medicine in the United States. Value-based care is the future, and we're leaning heavily into it. And what's very important for me is their ability to achieve financial success in this model. That's why we're so excited about this. It's the right thing for the patients, the right thing for all patients. And we believe that this is the future of medicine, and it's going to be very successful.